Of the fact that it's already 2 minutes past, so we're going to get on. Like I said to you, I'm aware also that many of you would have come back after a break, so welcome back. And for those of you who haven't either, welcome to our first session post school holidays of the developments in safeguarding webinar. As you'll all know, because you're all booked onto the session. This session, we're going to focus very much on recent practice reviews, information sharing and record keeping. Now, some of this information will intersect with professional curiosity, which is a session that we've ran previously, but I'll come on to that shortly. To introduce myself, before we move on, I'm Stephanie Freeth. I'm a Policy and Development Officer for the North Yorkshire Safeguarding Children Partnership. And with me today I have...
Hi everyone, Hannah Ellingworth, Manager of the Safeguarding Children's Partnership in North Yorkshire.
That's wonderful. So Hannah and I are going to go through this together, taking some parts each. As I've already said, boringly, I seem to have IT problems, so I seem to have no notes at the moment. So bear with me, be kind, and we'll get to where we can. Okay, now I've got them. That was a user error, totally. So let's move on. Housekeeping. Just as usual, I'm conscious of the fact that many of you are in offices, schools, so if you could just be aware of the noise behind you, it is recorded. So if you could please mute your microphones. Most of you have done that already. As I mentioned, the session is being recorded, so give us a couple of days after this session and it will go up on our YouTube channel. Please ask any questions that you have in the chat. I think it's really, really important to say that there's no such thing as a silly question. If there's something that you're thinking of, the likelihood is other people are thinking the same thing as well, and we need to explain it with more clarity or in a different way, and we're obviously happy to do that. So relax, listen. If you're having the opportunity to have some lunch, and we'll go through the session. As I've mentioned already, you can access all of our learning event presentations on our YouTube channel, as well as on our NYSCP website. We have specific sections for learning for professionals as well as training. If you haven't done it already, if you would like and subscribe to our YouTube channel, you'll get notifications of when we have new information up there. Also, please, as well as putting your name in the chat, please, following the course, complete the post-course questionnaire on the NYS site where you booked to obtain your certificate of attendance for CPD or anything else you may use it from. Also, please do feedback to us there, because we really want to tailor these sessions to be useful and appropriate, or you can put it in the chat, entirely up to you. Okay. So we've got quite a packed agenda today, and what I want to do with this is just set the direction of travel for the next hour or so. As we've said already, the learning event will review some of the key learning themes from recent audits and safeguarding practice reviews, and most importantly, their implications for practice across North Yorkshire, so how it impacts all of our practice and how we work with children and families. As we said, there's a particular focus on the importance of information sharing and accurate record keeping. And we're going to use a specific case example from a recent SPRIG review. And we'll go on to talk about what SPRIG is in a minute. We'll also be pulling in information from other case reviews just to show themes and commonality. So, as a partnership, we're really, really conscious that with recent reviews on a national basis, such as the Baroness Casey review into group-based child sexual exploitation and abuse, that we have recommendations that are coming from that. And with that, and you'll be aware yourselves, that there's really a greater emphasis now on information sharing and accurate record keeping. There always has been, but it's coming up more and more, as well as considering the impact of culture, ethnicity, and amongst other key areas. So we hope to cover some of that in the learning today. So, as I've said, we're going to look at what SPRIG is. You'll hear that term. We're very conscious as a partnership that we'll be coming from different knowledge bases. Some of you may have attended these events before and others like them Some of you may not. So we just want to recap on what that is. So what is SPRIG? Why do we have them? What are the parameters around them? What qualifies for review? Who can request reviews and how do they do it? What's the process? So Hannah's going to go through that very shortly. We're going to look at why information sharing and record keeping matters. We're going to look at the case review. We're going to look at the other reviews I've said. And crucially, we're going to look at practice guidance. So we know that safeguarding is everyone's responsibility. We know that our Bible, working together, tells us that, and that's something we live and breathe every day. But today is really about empowering that responsibility. So we want you to walk away with at least a couple of things that you can do in your everyday practice or share with colleagues in your everyday practice as well on a real practical level. And then we're going to look at what do we need you to know as part of this session. And if we've got time, because we're already 12 minutes in, we're going to look at some business unit updates. Okay, so at this point, I'm going to hand over to Hannah to talk about safeguarding practice reviews.
Thank you, Steph. So as Steph said, we're just going to have a little look at the process of reviewing serious safeguarding incidents for children in North Yorkshire. So when a child dies or is seriously injured, consideration should be given to undertaking a safeguarding practice review. Now, in North Yorkshire, that's managed by our Safeguarding Practice Review Group. So that's the SPRIG. And that's a multi-agency panel that reviews serious safeguarding incidents. We'll come on to think about what qualifies as a serious safeguarding incident, but just to understand the purpose of reviewing those incidents is to identify where improvements can be made to safeguarding practice, with the idea that that promotes the welfare of children. The purpose again is to seek to prevent and reduce the risk of recurrence of similar incidents. Now, the really important thing about this is that it's not about blaming individual practitioners. What we ask the Safeguarding Practice Review Group to do is to think about what a typical practitioner would do in similar circumstances, because when we understand that, we can then think about how we can change practice from a kind of system strategic perspective rather than at an individual practitioner perspective. So there are certain incidents that will reach the criteria to be reviewed by the SPRIG. When an incident occurs, information is shared with strategic leads in the partnership, and then a decision is made about whether the incident does meet that threshold. If it does reach that threshold, consideration is given to whether a referral is required to the National Child Safeguarding Practice Review Panel. So, as the name suggests, that's a national body that will review all serious safeguarding incidents. The decision to notify is ultimately made by the local authority, but in North Yorkshire, because we've got really good strategic relationships, we do that collaboratively with leads from police, health and the local authority. So if an incident does reach that threshold, a referral is made to the National Child Safeguarding Practice Review Panel, and then the partnership have 15 working days in order to complete what's called a rapid review. Consideration is given to three things in order to determine whether notification to the panel is required. So the guidance states if there's sufficient concern to trigger a strategy meeting, abuse or neglect at that point is at least known or suspected. Has the child been seriously harmed? This can be both physical, emotional, mental, real life or online harm. And then if that criteria has been met, a discussion then takes place to understand whether the harm is significant and ongoing. So, for example, isolated bruises on a baby wouldn't necessarily require referral to the National Child Safeguarding Practice Review Panel. Although that is significant for the family, there is that higher threshold required. So if there are bruises on a baby, consideration then is around the extent of whether those bruises are life-threatening, life-changing. So for example, if there was a child who had bruises, had a child protection medical, and then it was found that they had multiple limb fractures, that would then require a referral to the panel. So as I said, if it's notifiable, the partnership has 15 working days to complete a review. In North Yorkshire, what that review looks like is that we hold an initial meeting with multi-agency partners to understand how partners have been involved with that family. Once that's done, a report's written, and the main purpose of writing the report is to think about recommendations for future practice. A second meeting is then held to agree on those recommendations. So those meetings are held with strategic leads from key organisations who have the capacity to agree on strategic practice change. And then once those recommendations have been agreed through our partnership, it's managed through our practice and learning subgroup. So those recommendations are then implemented through the various organisations within the partnership. From a practitioner perspective, we hope that those learning points and recommendations are filtered through into your team meetings for discussion through the kind of managerial structures. All the learning from our recent sprigs have been summarised, and they're on the Learning for Professionals page. And what we are also doing is we do a summary of the learning, and within that summary there will be key points for practitioners to kind of take away, to think about how they can change their practice based on those recommendations. Sorry, Steph, I know I've gone off piste a bit there, but hopefully that covers the sprig bit.
It's absolutely fine. I'm just going to forward to the next page just to reiterate what you said already, the process of sprig.
So yeah, so you can see the a flow chart there that hopefully articulates what the processes are for the sprig reviews within North Yorkshire. So a referral is made to the Safeguarding Practice Review group. A discussion is had, multi-agency discussions had as to whether a referral is required to the panel, and or whether a local learning review is required. So if an incident doesn't reach the threshold to be notifiable, in North Yorkshire, we do also do local learning reviews. Again, that's because we're always thinking about how we can improve future practice in order to improve the lives of children in North Yorkshire. As it says on the flowchart there, that if a review is required, then we've got 15 working days, and then as a result of that review, alongside the recommendations that are written, there's also a number of possible outcomes. So the national panel can ask us to complete a local review where we would commission an independent reviewer. They can say that they don't believe that there's any further review required, at which point we would then start implementing our recommendations through the subgroup as discussed. And I think that's probably about it.
Thank you very much. I think something to say as well is, in terms of letting the partnership, North Yorkshire Safeguarding Children Partnership Business Unit, us aware, there's a form on the website. These are sort of things that you can have discussions with your direct line manager about, and when they are brought to the partnership, when they are brought to the business unit, as Hannah said, there's a discussion around whether any further action is taking place, and that might be national or local. For some of you, kind of like the old money, if you like, terminology of the national review referrals, ones that we'll all be aware of, like the Starr Hobson and Arthur Lavinia Hughes review. You will know of those, and those are the national reviews. So sometimes it can be quite complex, kind of, certainly was in my mind, kind of understanding which review sits where. And your national reviews are the sort of reviews where the panel believe that there is national learning to be had. Okay, so we're going to move on, and we're going to look at why does information sharing and record keeping matter. Now, this is where I kind of spring this on you guys and ask you to be a little bit brave. And if you wish, if you don't, it's fine. And we ask you to use the chat that Hannah's going to have a look at. So yeah, we'd like you to put in the chat, why do you think that information sharing, record keeping matters? Now, we know that safeguarding is everyone's responsibility, and we know because ultimately it keeps children safe. But we'd be really interested, given that your different backgrounds and different roles, why you think some of the things are important. So we're just going to let the tumbleweed flow for a couple of minutes, and hopefully you'll put some ideas in the chat. No right or wrong. It's really interesting to see what you think, because you're bound to come up with things that I haven't put on the slide.
So I'll start reading them out, Steph, shall I? So we've got you can't know everything about a family.
Yeah.
To build up a bigger picture, to keep a chronology, to look out for patterns. Putting all the information from different sources helps build the whole picture.
Brilliant.
Fill missing gaps.
Brilliant. So I'll just put up what I've got here. Apologies, lots of text on the page, but as so many of you have you know said, and you know because this is your everyday bread and butter. I think the first comment, no single agency holds a full picture. While it could be very, very useful for, if you like, a primary agency, the agency or school or children and family worker that is directly working with a child to know the most information, unless it's just single agency involvement, nobody can know everything, and we all have different experiences and different standpoints as well. As we put here, ensures all professionals have a full picture of the child's circumstances. Yeah, that's been said, filling in gaps. Really prevents fragmented or siloed decision making. So in the past, and you'll see with some of the information that we're going to look at in a minute, that fragmented communication and siloed working has led to missed opportunities to protect children and really to understand the situation from different perspectives. As someone's already said, makes it timely and coordinated. You can get on doing what you need to do to support families quicker. As somebody's already said as well, promotes accountability and transparency across agencies. We also know as well, and this kind of dips into the bottom half of your screen as well, into record keeping. Record keeping systems can be fragmented as well. Again, we'll talk about this in greater depth. Hannah and I were having a conversation earlier at a meeting that she was in, and we know that there are multiple systems across the partnership, across North Yorkshire, even sometimes within a particular area, like school or police, children and family services, and certainly. So something to keep in your mind for later. Accurate record keeping provides a clear and factual account of observations, decisions, and actions. Supports that continuity of care. So it's the same message all the time to a family, and they can be assured of what's going on in their life. Someone said it already, accurate record keeping and information sharing helps identify those patterns and is crucial, and has come up in safeguarding practice reviews, identifying cumulative risk. As someone said earlier in the chat, you're getting a full picture. If you have that siloed, fragmented information, you're not getting a clear idea of what could be happening over time, and that risk could be increasing or indeed decreasing as well, actually. And again, from a legal and procedural point of view, it helps with the compliance around that. And again, it gives a really strong evidence base for any interventions. Oh, sorry, you're going to be putting in. Let me just go back. Right. So moving on, as I've mentioned already, the national importance. This is something that is highlighted time and time again at national level. As I've mentioned already, there's been a the Child Protection in England inquiry in 2022 of Starr and Arthur. The main quote on the page there comes from Working Together to Safeguard Children, talking about the effective sharing of information between agencies and its importance, and how serious case reviews have highlighted the missed opportunities to record, understand and share information in a timely manner can have severe consequences for the safety and welfare of children. So this page just demonstrates and backs up the national review. As I've said already in reference in the introduction, most recently the Baroness Casey report, which talks about information sharing and recommendations relating to the mandatory collection of ethnicity and nationality data for suspects and victims. So you'll be aware that's something that's coming down the track at the moment as a result of that review, as well as enforcing information sharing at a mandatory level between safeguarding partners. So finally, I've actually got to the case review. So we want to talk about child AH, and I'll read through this because I'm conscious of the fact there's a lot thrown on the page in front of you. Now, again, building on what Hannah has already said, we're going through this case summary with the benefit of hindsight. So we want to think about information sharing, record keeping, that good practice and learning, and being professionally curious, because information sharing, record keeping, and being professionally curious, they all intersect. You can't really talk about one without thinking about the other. So have a think about what you would like to know, and as a practitioner, what you think you would have liked to have known as you've gone through. You can keep it in your head, you can put it in the chat. It's absolutely fine to do so. And again, we're looking at improving learning and looking at good practice as well. This isn't about individuals or agencies whatsoever. So child AH was an 11-year-old non-mobile infant, and they lived with both of their parents. Mum's family lived abroad. As you can see here, during the pregnancy, both parents attended all of the antenatal appointments. At that point, the father disclosed that he had dyslexia, and the mother disclosed that she had a history of eating disorders. Now, these disclosures were recorded, but they weren't explored any further. Health professionals noted no safeguarding concerned during both antenatal and postnatal visits, and they were given key messages on what we call icon messages. So some of you who aren't aware, around babies crying and what you can do to cope and what is normal, and around that, and getting support around that. They also delivered safe sleep messages in various formats as well. At 6 weeks old, there was a virtual health visitor contact conducted online. And when baby was 7 weeks old, a GP check in person was completed. And at that point, no concerns were raised during either of those contacts, online and in person. But when the baby was 8 weeks old, Dad contacted NHS 111 reporting that the baby had been crying and screaming for 4 hours, and it appeared that the baby had pain in one leg. So as a result of this, 111 completed a full assessment and advised Dad to take the baby to casualty A&E, ED as we now call it, within a 4-hour time frame. Now, as a result of that call to 111, an electronic referral was sent to the hospital, to the emergency department. Also, a safeguarding referral was made to the multi-agency screening team, because of being a non-mobile baby. And what is called a post-event message was sent to the GP. Now, at this point, and we'll talk about this again later, NHS 111 systems and primary care aren't linked. Many systems, especially in the health area, perhaps aren't linked in the way that we think they may be. So the call handler sent the message through to the GP as well. The internal system at 111 was checked, and it was seen that the child wasn't known to any children's services. So just to give you a little bit of background on that. So upon attending the hospital, Unfortunately, multiple bruises and a lump on the baby's head were observed. Due to that, a skeletal survey was performed, and that showed suspected healing rib fractures and other injuries that were unfortunately indicative of non-accidental harm. And a second survey confirmed multiple fractures at various stages of healing. Now, again, emphasising that the baby was a non-mobile baby, and the medical view was that the injuries that the baby had sustained were likely to be non-accidental. Both parents were arrested on suspicion of grievous bodily harm, and the baby was then put was then an interim care order, excuse me, was granted, and baby was placed in the care of the wider family unit. The local authority referred the case to the National Child Safeguarding Practice Review Panel, the panel, which commissioned a rapid review. So that's the background of what happened. Hannah, feel free to jump in at any point should you wish to. So we've had an overview of the case. So what we want to do is look at some of the learning from the review. And like I said, an opportunity to identify good practice and improvements. So on the left-hand side of the screen in black, you'll see the learnings. And on the right-hand side in blue are some of the questions and thoughts that came to us in relation to information sharing and record keeping and professional curiosity. So have a think about what you would like to know. So Dad's dyslexia was recorded but not explored. And the reason we've pulled this out is because a review questioned how this could have impacted his ability to process safeguarding messages or support, or his general state of mind and mental health. And it's a really, really good example of, we're absolutely confident there was a rationale behind why this wasn't explored further, but there's no analysis within the record to tell us this. So the point in this is it's really, really important to put the why, not just to record the facts, which are obviously, key, but to record a practitioner's analysis of why you're thinking what you're thinking and why you've taken the decisions you've taken. So the Sprig emphasised the need to include fathers as well, really meaningfully, as well as part of this, which is a message you'll see throughout this. And we'll come on to this a bit later. So as well as the analysis in record, Sprig emphasised the need to include fathers meaningfully as well in those conversations. And again, this has been picked up as part of several reviews. There was one back in 2021, which I think is the myth of the invisible man, myth of invisible men, that talks about this, should any of you want to go away and look that up. So mum's history of eating disorders was recorded but not explored. Again, the same point about record keeping, reflecting analysis, not just actions, but also exploring what does this mean to her? How did she feel about what was going on? How did she feel about a potential loss of control? Going back to what I said earlier, was there a cumulative risk? Were there cumulative risks occurring that perhaps may have been found through some of the recording of this information? Would it have been helpful for this information to be shared? So health systems didn't prompt practitioners to explore dad's mental health post-birth. So as many of us will be aware, postnatally for mums, health records go through a set of questions and prompts to understand parental mental health. And this is a system situation, if you like. This isn't down to actions of a practitioner. There are system prompts to talk about mum's mental health, but not dad's mental health. And we know that postnatal depression is very much a factor for dads as well. So just a factor to think about it. Again, the review pulled out that virtual contacts may have limited opportunities for physical examination and really getting to know the families. My understanding is, and Hannah, correct me if I'm wrong, that sometimes these virtual contacts are performed by health visitors that families might not know, so it's not necessarily the same health visitor all the time. And I wonder whether that has impact as well. It might lead to less detailed or kind of more nuanced information being shared between professionals. Perhaps some of the observations that we might have naturally in person may have been missed or not recorded, or perhaps things could be picked up conversely as well. So that's another factor to think about around that as well. Also, as many of us may know as well, in terms of follow-up, that might require more follow-up, or that might be difficult. It might be difficult for parents to share information, which could lead to gaps in documentation and missed opportunities for intervention. Also, any of you that have conducted joint visits will know that that's going to be, and those of us who worked through did this job in COVID as well, know that those joint visits are really hard virtually as well. So something else to consider. As it said here about the myth of invisible man, we've mentioned postnatal depression, but I picked out actually a quote from the practice review on child AH. It says, fathers are statistically more likely to cause harm to infants, yet are often under-engaged by services. So just something to think about in there. So moving forward, as I said, health visitors and midwives delivered those icon messages and safe sleep messages throughout different touch points as well, both pre and post natally, and in loads of different formats that worked for the family as well. Push notifications, using the HFDT app whilst in hospital, using videos, that sort of thing. So parents received really consistent messaging throughout. The NHS 111 call handler initiated multiple referrals, as you heard earlier, and notifications, including to A&E, and crucially with safety netting. So sent information to the emergency department, essentially saying, we've told the family they need to come within 4 hours. So the emergency department knew if this didn't happen. They also sent information to the GP as well. So again, if this wasn't followed up, that safety netting was really put into place to make sure that child was seen. So it was really thorough and thought out support. And as you can see on the right hand side here, again, I've included a quote: electronic referrals and notifications were praised as gold standard practice. So just really showing the impact that that can have. So moving through, further from this stellar practice, it continued with A&E staff. They conducted a full examination of the baby, documented the injuries by using a body map, I think they call it, and escalated those concerns appropriately. The emergency staff undressed the baby, and we've seen in another safeguarding practice review, I think it was child Y, of a child that was taken to the doctors, again, non-mobile baby who sustained bruising and injuries, where the doctor unfortunately didn't undress the child on that occasion. So this is an example of actually learning from that review, which is wonderful, and showing some really thorough practice about the mapping and early identification of injuries, and then from that the correct triage in order to get the skeletal surveys done and strategy meeting. So talking of that, a coordinated multi-agency response followed, including that strat meeting and medical assessments, actually over a bank holiday weekend as well, showing that it was timely, well thought out, even despite some of the challenges that may exist over bank holiday weekends. As I said earlier, primary care, GP were kept informed, despite the fact that they weren't able to attend that strategy meeting, so giving them the full picture. And as a result of that, safeguarding flags were added to the child's primary health record. And again, I've picked out safeguarding flags were added to the child's primary health record, recognised as the single point of truth. We'll talk about this a little bit further on. And lastly here, agencies responded in a timely and coordinated manner with strategy meetings held appropriately and parental contact supervised. So again, as I said earlier, done in a timely manner, flags added to the child safeguarding record, meetings held promptly, decisions made promptly, meaning that the child was in a place of safety. Okay. So I'm cognizant there's a lot to take in. Hannah, will you let me know if there are any questions or comments? So really getting over the importance of sharing that information and recording it, and showing what an absolute benefit that can be, and how that can really help, and some of the areas of learning as well. So just kind of briefly on this, what have other reviews told us? Well, we've referred to some already, but let's look at Child X, who, as you can see here, at the time of the review was a 6-year-old child. So this was quite a recent but complex Sprigg case. So the 6-year-old child's parent was in a polyamorous relationship with 2 transgender adults. The child had previously resided with their grandparents out of North Yorkshire. The child's parent then made an unplanned move to North Yorkshire with 2 adults who they had met via social media. And actually, this was the first time of the parent having responsibility for the child. And the child was a significant distance, as was the parent, and from grandparents and their support network, and they were considered vulnerable. Sadly, it transpired that child X received significant injuries, which were highlighted in bruising and marks to the child. So in terms of learning and improvement with regard to information sharing and record keeping, we learned that practitioners attributed child X's challenging behaviours that they had solely to possible neurodiversity, very much having that single story without exploring alternative explanations. The child actually, and unfortunately, didn't look at things like trauma or emotional neglect, potentially as a result of what they were experiencing at home. So really looking at the lived experience of the child and really highlighting the need for professional curiosity. So crucially, and this crosses over with information sharing and record keeping, the child referred to the 3 adults in the house all as dad. But unfortunately, it wasn't clarified who the child meant by dad, and if it was, it wasn't recorded, unfortunately. So when the child said, for example, "Dad hit me," it wasn't clear on who this was. Now, we absolutely understand that there's sometimes, as a practitioner, I know because I've been there myself, there's a nervousness around discussing certain things, ethnicity, religion, transgender identity as well. And again, the practice review picked up on a hesitation in asking what were perceived as personal questions of transgender adults, which impacted clarity in the assessments that were had. And like I've said, we've seen this in other reviews in respect of religion and ethnicity as well. Also, the records in respect of child X showed the use of confusing and sometimes inconsistent terms. And within one record, we have birth mother, birth father, mum, and father, whilst the other adults in the house were listed as parent, and which I'm sure you all agree is really confusing if you're reading it as an outsider in, or from a multi-agency perspective, trying to understand what the situation was in the household and really trying to understand that child's lived experience. Again, we found this in other multi-agency reviews as well, specifically in our joint targeted area inspection, focusing on domestic abuse. We found that when professionals use inconsistent language, it can really muddy the waters. And that was very much picked up in the JTI. Moving on from that, the assessment unfortunately didn't cover all of the adults in the household. So there were gaps of knowledge, as someone mentioned earlier, and misunderstanding of the family dynamics and worries. We do recognise there's a lack of nationally recognised guidance for documentation and how to document information on families that have transgender individuals as well. Also within records, facts were stated within agency records, which is great, but not really backing up where this information came from and whether it was a credible resource source. Again, that's something we've seen in other findings. Okay. I've mentioned the JTI already. So this was a joint targeted area inspection that some of you will be aware of happened earlier in the year. And for those of you that aren't aware, they're a national program of thematic inspections, and the topic currently is domestic abuse and the impact of domestic abuse on unborn children and children. So that happened earlier this year, and the information that we found from that, again, in terms of information sharing, it came out highly. in a number of different ways. So learning from it that as part of the JTI Inspectorate found that agencies shared information really well to understand a child's lived experience, and good practice was identified in the health sector despite having these differing systems. We talked about the importance of addressing fathers' mental health, but in this arena, in relation to domestic abuse, it was found as part of the JTI that fathers' mental health was discussed, and referrals were made on the back of those, enabling really effective early information service, especially with the probation service, as well as using domestic abuse and child protection flags being really, really effective when GP records are shared. Also, as well, the inspection found themes already identified in challenges in record keeping, including incorrect demographics, as mentioned earlier. Also, it found the need for accurate recording of family relationships, as mentioned, and also pulled out IT system incompatibility and how that can hinder information sharing, as mentioned as well. So the point being, these are the same points, but they are coming up in different areas as well. And again, as mentioned with child AH, that multi-agency assessments can sometimes lack complete information. Okay. Throwing a lot of information at you. I absolutely understand. So this is the kind of key point from this, and Hannah, I'd really welcome your input on this as well. So as a result of learning all of this information about the importance of information sharing and how it can impact children and families, I'd really like you to think about some of the practical steps that you can take immediately forward with this learning and the case reviews discussed today. What can you pass on or reiterate to your colleagues? So we've put some pointers here. We'll send this information round afterwards. If there is anything that we've missed, let us know and we'll add it, because you can absolutely use this as a checklist in the short term should you wish to, or share it with your teams as well. So we've mentioned professional curiosity an awful lot in this. So someone said rightly earlier, single agency information must be shared to avoid a single story. We need to dig deeper. We know that with Child X, there were worries about asking what may have been perceived as sensitive questions, but this would have been increased professional curiosity. I think really the message that we're getting from this, if you don't know, ask. Race, cultural identity, ethnicity is not something that's always curiously explored. And I think as practitioners, we all need to take some responsibility for informing our own work, having this knowledge and understanding how to use it. As we said earlier, I think Hannah and I were saying, especially earlier, from our own personal experience as well, there's this fear of getting it wrong or being worried to ask questions in case it offends someone, saying the wrong thing. But I'm sure many of you will agree that when you've worked with families, or when you're working with families and young people, actually asking them is really, really useful in terms of, understanding their life better, not just from a safeguarding perspective, but so you can understand the family better, how you can get things right and all that sort of thing. Hannah, I don't know if you want to come in there because I've talked a lot.
Yeah, I think there's something, isn't there about recognizing your own sort of power and privilege when you're in a family's home or talking to a family, and being open and honest about, so I as a white woman will have a different experience to somebody who is not a white woman.
Yeah.
And how do we kind of recognize that difference, and then once we understand the difference, how does that then impact on the work that we do with a family, or how does it help us create a plan that recognises that child and family's cultural identity and the impact that that has then on their lived experiences? So there's the bit about asking the question, but there's also the bit about what do we do with it once we understand that information.
Yeah, absolutely. Moving on from that, again, we've talked about it already, but one of the other things we really want to focus on, you can take away into practice, is sharing information proactively. I think the rule of thumb is assuming information hasn't been shared, not waiting sharing relevant information with other agencies, with other partners. Something that has come out of recent safeguarding practice reviews, really simple stuff, like ensuring mailboxes, voicemails, other forms of communication channels are monitored, and not having individual email addresses when it's coming to things like a safeguarding lead or a DSL. As I said, we've had case examples from recent audits where messages have actually been missed because, understandably, somebody's busy, they go off sick, and mailboxes aren't always monitored. So it's about thinking about things like that and kind of avoiding assumptions that others might know what you know already. Also ensuring meetings include the right professionals and that decisions are based on shared information and evidence as well. As we said throughout this, document thoroughly. So ensure those records are accurate, timely and factual with no ambiguity in the way that we identify people, especially adults. So kind of moving away from saying, you know, dad's partner, mum's boyfriend. We've actually linked a lot of guidance following on these slides, and there's some really useful NSPCC guidance on this in the slide deck. I think, again, as I said earlier, if you're not sure, ask. You use your management structure. If you're not sure on what to do, and again, later on in this information, we'll refer you to other places that you can go if you're unsure for clarity. As we said before, records should state what has been said and done. However, they should also reflect a practitioner's analysis and understanding of cumulative risk as well. Talking about facts as well and being backed up, as well as their source, to be quite specific. So instead of saying things like warm interactions, kind of quantify, what does that mean? What does that look like? You know, mum and baby were looking at each other in the eye, baby laughed, that sort of thing. And for those of you that don't know, we have a campaign which is Ask Me that really helps with this, which helps you be more professionally curious about how to ask questions, to make the sort of questions that you're asking families less transactional and more conversational. So that's something we definitely signpost you towards. Again, promote that multi-agency planning, making sure that the right people are included on assessments and that assessments are smart and multi-agency. As we said before, ensuring that plans reflect input from all services. Again, as I've said before, supporting families with tailored conversations, so using the Ask Me tools, asking open questions, and really being curious and exploring those multiple hypotheses. I've just said, you know, moving from information given to having actual conversations and meaningful dialogue. And this is not saying by any way, shape or form that, you know, people, children's workforce practitioners aren't doing this. This is just picking out areas. And it might be really useful for newer members of teams as well to share, or as CPD refreshers. And again, tailoring those messages to families when their situations change as well. We'd also at this juncture as well refer you to our guidance on the NYSCP website. As we said before, we've got information there about information sharing, professional curiosity and record keeping, as well as some of the guidance we've referred to. And they're not in full reports, we're in very kind of bite-sized 7-point briefings for you to have a look at and share with your teams. As well as attending events like this and other resources on our website. So please do try and make time to have a look if you're able to. So what do we want you to know? Again, this has been mentioned throughout, but just be really clear on systems that they can be fragmented as well. So to really bear that in mind. Again, I go back to this practice from Child X with the 111 call handler, sending emails to the hospital, sending emails to the GP's surgery to really, really tie things up. So being really cognizant of the fact that different systems don't connect at times. And if you're not sure, do ask that question. Also for practitioners to be aware.
Steph, sorry.
Yes.
Sorry, I was just going to come in on the health systems. So
yes.
We know that there are multiple health systems within North Yorkshire, and that those health systems don't all talk to each other. So, for example, if you have asked for information from a GP, the health visitor information might not be included as part of that, or the midwifery information might not be included as part of that, because they use different systems. As a business unit, what we've done is we are in the process of creating a document that should help practitioners understand a bit more what the health economy looks like in North Yorkshire. So we'll make sure that we share that with everybody. But I just wanted to say that it's really important to be aware that just because somebody's got an NHS email address doesn't mean that they know or have access to information that someone else with an NHS email address has. Thank you.
Thank you. No, absolutely. You put that a lot better than I could have. But yeah, absolutely. And as Hannah said, even within the health economy, you know, sometimes that isn't that single view. So just being really, really aware of that, especially when you're talking across borders as well. You know, we work in a huge county, but we know as well that it is bordered by other areas as well. And so when we're considering, you know, families that may have moved or maybe seeking assistance in different places for whatever reasons, of which there are multiple, it's to be, you know, aware of that as well. So yeah, as we said, there are no safeguarding flags or alerts across systems. So as we know, if you record something in CPOMs, it doesn't mean that someone at Children and Families is going to get that, or vice versa. So in terms of the information sharing, we've talked about avoiding that single narrative, but how do I know if it's okay to share information? And I think sometimes this is a really difficult area sometimes. So without doubt, safeguarding comes first. So sharing information is likely to protect or safeguard a child, young person, or indeed an adult, actually share it. You know, concerns about sharing information cannot be allowed to stand in the way of the need to safeguard children. It's about using your professional judgment, considering the context, the urgency and the relevance of the information, and following your own organisation's procedures. Like I said before, you know, if in doubt, it's about using your DSL, your lead of safeguarding, consulting with them, because that's what they're there for, and they can help you consider the principles of information sharing. There's also information on our website as well about information sharing, and talks about different parameters, what you should share and when, all around that. But I think if you just take one message away from today, it's if you don't know, ask. I've put here the Children and Families Professionals Consultation line. So those of you who may not know, as the name suggests, it's a line for professionals to use if they have safeguarding worries about a child that isn't open to services already. It's manned by a social worker, and when they are not there out of office hours, it is manned by the emergency duty team, also a team of social workers as well. So they'll be able to advise you. As I've said, you have your own safeguarding leads. The NSPCC has a professionals line and email address as well. And I know within different settings, you have different places you can go to. Your school liaison officers for police, using their Padlet, using your from an early help perspective, speaking to your early help consultant if we think these concerns aren't a safeguarding concern, and PCSOs. So there are lots of different places that you can go to. I am cognizant of the fact that we're running out of time. You will have this slide deck to look at. There are some helpful resources, lots of them. Please have a look at them. I think for today, we'll suspend the North Yorkshire Safeguarding Children Partnership Business Unit updates, but we will send them through to you. I would encourage you to tell your team members about any training and learning online so they can have a look at it. But while we've got 4 minutes left, what I'd really, really like to do, and I'm sure, Hannah, you've got some questions as well, is open the floor for questions. And also ask you with regard to this, we've talked a lot about information sharing and record keeping, and we've got a bit of a checklist there, but would it be helpful for you to have some definitives, to have some questions that you could ask in certain situations, whether it's about cultural identity, religion, transgender individuals or families? Or is that something that anybody already has access to and would like to share with everybody else?
I'll give a bit more context around that, Steph, if that's okay. So we've talked to the partnership about developing something called Talking Tips. So it would be a kind of series of campaigns really around helping practitioners have various conversations with children and families. So we've got something in our harmful sexual behaviour guidance around having difficult conversations, but we've wondered about whether talking tips around race and ethnicity might be useful. We know that people want to get it right, and sometimes that means that people shy away from it because they're nervous about getting it wrong. We'd also wondered about having something to do with self-harm and suicide ideation and discussions that we could have with children and young people around that as well. It looks like people are saying in the chat that that would be helpful. So
it's really useful.
That's great, and something that helps us kind of think that we're along the right lines really in developing something that looks like that.
Yeah, if there's anything else that you'd like to add to it, please do come back to us. Talking Tips was a campaign that we're looking at running later in the year, and actually it was born out of a result of speaking to schools about the harmful sexual behaviour toolkit and then raising some suggestions. So we've had some fabulous suggestions. So if you have more or something we're missing, please do let us know.
And then, sorry, Steph, and I was just going to say, if people could have a think as a result of today, what they would take away from this meeting, because what we would really like is to hear from people about what they've done as a result of attending these learning events. So are you now going to go and have a conversation in your team meeting? Are you going to, I don't know, email your team and say, I've learned this, this and this from the learning event, and I really think that in our team we can make some changes. If people are able to do that, either writing it in the chat or getting in touch with us after to let us know what you're doing as a result of attending the learning event, we'd be really grateful. Thank you.
Thank you. And on that as well, as I've said, other things that we can do, other learning events that you would like to see, or perhaps parts of this that didn't land so well, because we're very conscious of the fact that this is an hour of your time that you're giving up, and we want to make it work for you and for you to get the messages that you need. But unless there's nothing else, at a minute 2, we'll stay on should anybody have any questions they want